Hey everybody, Dr. Doug, Bodyworks Physical Therapy. Hey, we're here today and want to talk to you a little bit about concussions. And we see a fair amount of concussions here, and what I heard one time was concussions are like a snowflake. Everyone's just a little bit different. And so today we brought somebody, this is Michaela. She's experienced a concussion or two. And so I just want to kind of have a little interview here about what she went through, what it was like, how she's doing now. And so I want you to hear from a patient's perspective. So Michaela, how many concussions have you had?
So I've had 4 in total, but two of those 4 were sustained during one season earlier this year.
And what sport do you play?
I play soccer.
Okay, cool. So in the last several years you've had 4?
Yep.
Okay. So when you did have a concussion, what was it like what was it like?
It was a little bit different every time, but each time it was, I think disorienting would be the word I would use. Just everything felt just a little bit off. Like lights seemed brighter, noises seemed louder. I stuttered a lot.
Really?
Yeah.
So you couldn't get the words out. You knew it, but you couldn't get them out.
Yeah, and it would take me several tries to say words, say sentences the way I wanted to.
Yeah. Did you have any sleep issues, or sleeping too much, or couldn't get to sleep, or couldn't shut your brain off? Did you have any trouble there?
I didn't, but I know that other people have.
Okay. All right. Good. So now that that's behind you, how are you doing now?
In general, I'm pretty good. No issues in day-to-day life. Whenever I do play soccer, I try to be a little bit more, I guess, careful about how I play, how I take headers.
Do you head balls?
I do, but I try not to take, when I know they're coming in really hard, I try not to take them down with my head. I try to take them down with a shoulder or something else. Do
you wear anything when you play soccer?
I do wear a concussion band.
Yeah.
It doesn't fix everything, obviously.
You think it helps any?
It at least reminds me that I have something to keep an eye on. So
Yes.
At the very least, that's good, right?
Yes. So, I mean, honestly, because sometimes you forget and you just run right back in there, and then things can happen again. And you go, "Why did I do that? I need something to remind me." So that's a really good.
Well, and that's what happened to me this spring. Was I had one concussion and I went back in too fast and too hard and got another one shortly after. So the reminder is very important.
So how did all that work with them being in school with a concussion? Did you do anything to help you get through school and keep going?
So I went to see my physical therapist, Dr. Doug. Imagine that. And in addition to just some exercises that helped, he also gave me this handy pair of concussion glasses.
What do you call those?
I think they look kind of like pink Bono glasses.
Yeah, all right.
I
You
think
too.
They're great, yeah. So,
but they work, don't they?
But they work really well,
Yeah.
and especially when I was having to study and prep for finals and all that stuff.
Yeah.
Being able to kind of shut off some of the functions that my brain was having to do to be able to focus more was very helpful.
Yeah, use the glasses. The glasses help kind of just turn down life, so they're not as life is not as loud with all the sight, the hearing, all the visual, all the stimuli coming in. It just kind of takes life and just goes, and when you put them on, people go, well, that's kind of nice. And especially if they have to be on a computer, and just the bright light from the computer, it helps them to be able to be on the computer longer to get your schoolwork done. So, okay. So last question, what would you tell someone who's maybe had a concussion or is going through having a concussion?
I would definitely say don't try to do things that you're not ready to do. Don't go back to practice sooner than you think you should. Don't try to go back to doing school or work or everything maybe at the pace you were doing before until you feel like you're really back to normal, because it just, at least for me, made it a lot worse and made it last a lot longer.
So be patient with yourself, and allow the process, allow your body to heal and get better, because if you go back too fast, you can have some subsequent downturns and struggles, and then motivation, and things just kind of hang on for a lot longer if you don't take time to take care of yourself. So anyway, that's about it for today. I just wanted to kind of give you a quick snippet on concussions and kind of what they're like, what they're like going through, coming out of one, what you can do, and if you do have one, we see patients that have concussions from sports, motor vehicle accidents are a big one, falls, and you're just not right in the head. Your vision's off. You can't. Things are blurry. You have trouble speaking. You have trouble processing. You might want to see somebody. And we see a lot of concussions here, so why don't you come see us here at Bodyworks Physical Therapy here in Wichita, Kansas. If you have any questions, we'd be more than happy to talk to you on the phone. You can call us at 558-8808. Thanks.